When we are sick, doctors make us better. When we are injured, nurses dress our wounds. And when we need comfort, healthcare workers are here to help. The medical and healthcare industry is an essential component to our idea of a long and happy life. And a vital element of this industry is safety. With that in mind, we will discuss 6 areas of safety and health concerns that are common to most healthcare facilities and which may present a high level of danger. They are 1. Blood-borne pathogens. 2. Sharps and cuts. 3. Ergonomic injuries. 4. Slips, trips, and falls. 5. Chemical hazards. And 6. Disaster planning. One of the most universal hazards in the healthcare industry is blood-borne pathogens. These can be communicated a variety of ways, all of which are extremely hazardous to both patients and workers alike. These pathogens include, but are not limited to, the hepatitis B virus, HBV, and the human immunodeficiency virus, HIV. These viruses can be transmitted a variety of ways, all of which are extremely dangerous to workers and patients alike. Needle sticks are among the most common ways to transmit blood-borne pathogens. Accidental punctures by contaminated needles can transfer serious diseases such as HIV, hepatitis B, and hepatitis C, in addition to very harmful bacteria. Unfortunately, needle sticks happen frequently, but luckily they are also easily preventable.
Whenever a staff person gives an injection or draws blood or starts an IV on a patient, there is the risk of sticking themselves with the needle, and if that needle happens to have infectious material on it, then they can inoculate themselves and become infected. Hepatitis is this way. HIV, for example, can occur as well. And so we have special rules about how we handle these needles after the injection or the IV is started. And they're put in a special container, so they're segregated and handled differently.
These are the holders for the sharps containers. They're locked up so people won't steal the needles. Also, so they won't get exposed to the blood that's on the needle.
Sharps containers should also be located in close proximity to any place where needles are being used, so that they may be disposed of quickly. In addition to discarding, healthcare workers who are handling needles should take their time. Rushing to do a job may cause carelessness, which could lead to an inadvertent stick.
The best way to prevent needle sticks is to have engineered safety needles that either will guard the needle or shield it or protect it after using it.
If there is a particular trend in needle sticks or a particular time or event during which there is a high incidence of these injuries, management needs to quickly address it. Blood-borne pathogens can also be transmitted through the air or through direct contact with the patient. One very simple way in which to protect yourself and your patients from infectious disease is to wash your hands. Experts recommend washing even if you are just entering a patient's room, regardless of whether there is actual contact. This will help to reinforce the habit. The recommended length of time to wash your hands with warm water is 15 seconds. Be sure to scrub the backs of your hands in between the fingers and particularly around the cuticles. When done, you should turn off the faucet with a paper towel and then dry your hands. It may seem like a lot of detail for such a simple task, but the detail is extremely important when preventing the spread of disease. Dangerous instruments such as knives can also present hazards to the healthcare worker outside of just communicating disease. They are extremely sharp and can cause serious injury if not handled properly. Experts say the best way to prevent against these type of injuries is to slow down and act in the calmest manner possible. There can often be a rushed energy inside an operating room, but experts say that can lead to unnecessary injury, and just taking your time to do the work correctly and safely is the best approach to healthcare.
One can be very productive, and you can be more productive actually while being safe, just taking the time to pause and hand the instruments off correctly, letting the nurses know what instruments you're going to need next, taking the time with the sharps. So it's easy to be productive, and I'm also very safe.
Another area of serious injury is ergonomics, physical injuries which occur from repetitive motion or heavy lifting. This is an area of increasing concern in the healthcare industry and affects nearly all facilities and specialties. Recent U.S. Department of Labor statistics indicate that nurses' aides, along with other non-healthcare related industries, account for 1 in 5 musculoskeletal disorders. The American Hospital Association says that ergonomic-related injuries account for the largest proportion of workers' compensation costs in hospitals and long-term nursing home facilities nationwide. It is important to be diligent about performing safe lifting in order to keep these numbers low. Although a patient may not seem heavy, it's important to take the proper precautions when moving someone, such as using a lift team if available, or if you're working in a patient's home, it's important to urge that person to acquire the proper equipment. Here are 4 helpful tips to prevent lifting injuries. 1. Warm up before lifting any load. This will help prevent muscle strains and pulls. 2. Bend your knees with feet slightly spread for balance and stability. 3. Do not twist. And 4. Don't be afraid to get help if you are unable to lift a patient by yourself. Here are some additional things to watch for. Repetitive motions. If you're doing something over and over, it's very important to make sure you're doing it correctly. Awkward positions. If it feels awkward or unnatural, you may be doing it wrong. Using a great deal of force. If you're exerting a lot of energy, such as pushing chairs up ramps, then you should pay very close attention to the way in which you are moving. Yet another area of great concern for the healthcare industry is slips, trips, and falls. There are some easy solutions to help prevent slips, trips, and falls, which include keep floors clean and dry. In addition to being a slip hazard, continually wet surfaces promote the growth of mold, fungi, and bacteria. Where wet process is used, maintain drainage and provide false floors, platforms, mats, or other dry standing areas. Use no-skid waxes and coat certain areas with grit to create non-slip surfaces, such as in shower areas. Provide floor plugs for equipment to keep power cords from crossing walkways. Temporary electrical cords that need to cross an aisle should be taped to the ground. Relay or stretch carpets that bulge or have become bunched to prevent tripping hazards. Provide adequate lighting, especially during night hours. You can use flashlights to enter a patient's unlit room. And eliminate cluttered or obstructed work areas. Although each healthcare site is different, most deal with hazardous chemicals in some way, which is yet another major cause of injury in the industry. Hazardous chemicals are another concern, and they may be found in the air, on surfaces, clothing, medical equipment, and even in patient urine or feces. Chemicals which can be of danger to healthcare workers include those used for cancer chemotherapy, antiviral drugs, hormones, some bioengineered drugs, and others. Employers who handle such hazardous chemicals or drugs should take precautions to ensure their employees are not injured. Prepare a written inventory of all hazardous chemicals and drugs used in the workplace and update it frequently. Train employees to recognize the dangerous chemicals and drugs. Consider designating an area solely for preparing these items and make it accessible only to authorized personnel. Provide and maintain ventilated cabinets to prevent exposure. Filter the exhaust from ventilated cabinets with high-efficiency particulate air or HEPA filters. And provide to employees who come into contact with hazardous drugs or chemicals personal protective equipment such as chemotherapy gloves, non-absorbing gowns, along with proper eye and face protection. A fairly new area of focus for some agencies is disaster planning, particularly with in-home nursing care. In light of recent emergencies across the country and the world, preparing for a disaster like a major hurricane is something which must be considered in a complete safety plan.
What we need to really focus on, especially since we've seen all of these disasters that have been happening across the nation, is to really be prepared for emergencies. We have set up emergency procedures in our company so that if something should happen, that we can't anticipate. All of our caregivers know what they're expected to do. All of the managers here in the office know what's expected to do. We have partnerships with businesses out in the community to provide supplies and care for our clients, and we really need to have something in place.
Caregivers are issued a binder with the pertinent disaster planning information that is always on hand so they know what to do in case of an emergency. Healthcare is a growing industry and will continue to face challenges and make progress in the years to come. But one constant is the need for safe workplaces and procedures. It's important to constantly emphasize the magnitude of safety and the proper ways in which to handle equipment, patients, and the like. Repetition is key.
It requires changing habits or developing habits, so it's a continuous process of work and reinforcement.
No matter what the future holds for healthcare, keeping patients and workers healthy is the top priority.